Hi everyone, I'm Dr. Monste Blasco, and today I'm going to present the manuscript Transferability of an Executive Function Intervention in Children with CP, a randomized controlled trial. This study has been conducted at the University of Barcelona with Dr. Josep Puello as the principal investigator. So we know that people with CP present general and specific cognitive functions that have an impact on the daily life, including the quality of life, and it's important to optimize interventions to improve these cognitive functions. So among these cognitive interventions, those focusing on executive functions seems to produce a higher effect, obtaining near and far transfer effects. So near transfer effect refers to improve a domain that has been trained, whereas far transfer effect at those transfer effects that are in domains or cognitive functions that had not been trained directly by the intervention. Apart from that, to optimize the interventions, it's important to include to achieve interventions that maintain the effects obtaining in long term. So in individuals with CP, there are some executive functions interventions that have found both near and far transfer effect. However, there is a gap in the literature and we don't know the long-term effects of this type of interventions and also the impact of these interventions in the daily life, including quality of life and participation. So the aim of this study was to explore if a home-based computerized executive function intervention could improve memory, visual perception, quality of life, and participation. And second, if these transfer effects, if any, will be maintained 9 months after the interventions. To investigate we have a sample of 60 participants in two groups. The intervention group and also the usual care group. So there were 3 assessments, one before the intervention, one after the intervention, and the last one 9 months after the intervention. It was included a comprehensive neuropsychological assessment, including memory and visual perception assessment, and also other demographic, clinical, and psychosocial variables. So the intervention was during 12 weeks with a total dose of 30 hours, including core and higher order executive function tasks. So if we move to the results, there were improvements in immediate verbal memory and in verbal learning. However, it wasn't found improvements in long-term verbal memory. And related to the visual perception, there were improvements in the object recognition domain. Regarding the daily aspects, not improvements were found in quality of life and participation. And the improvements found in immediate verbal memory and learning were not maintaining 9 months later. So it seems that our interventions improve some specific cognitive domains, but not others in long term. And this could be because it's more common that one executive function intervention could produce near transfer effects rather than far transfer effects. Apart from that, it's important that maybe the assessment tool should be reconsidered, including more sensitive tools to assess the visual memory and visuospatial domains. And it's important to consider the inclusion of more resembling aspects to obtain improvements in daily life aspects, as for example, the quality of life and participation. Finally, to improve the daily life aspects with executive function interventions to obtain these improvements and also to maintain over the time, it could be interesting to consider the effects of to include a booster dose to maintain these far transfer effects. So to sum up, it's important to consider that it could be obtained far transfer effects without executive function intervention, and in further research is needed, including a more comprehensive assessment, and also consider the whole spectrum of CP severity to identify specific strategies for each case. So thank you so much for your attention.